Gentlemen, what if I told you that something you do regularly, something you think helps you relax and feel confident, is actually cutting your blood flow by 50% during the moments that matter most? Most men over 50 have absolutely no idea they're making this mistake. In fact, they believe they're doing something that's helping them perform better, but in reality, it's sabotaging their circulation, stealing their firmness, and destroying their confidence from the inside out. I'm Dr. Mika Hayashi. I've been a practicing urologist for over a decade, and I've spent those years helping men restore their sexual vitality without relying on risky medications. And today, I'm going to reveal exactly what this hidden mistake is, why it's so damaging to your performance, and most importantly, how to fix it starting tonight. Stay with me because by the end of this video, you'll understand why this one simple change could be the difference between feeling 50 and feeling 30 again. Before I reveal what this mistake is, you need to understand something fundamental about how your body actually works during intimacy. An erection isn't magic. It's not just about desire or hormones or even age. At its core, an erection is a hydraulic event. It's pure biology. Think of it like a fire hose. When water pressure is strong and the hose is wide open, water rushes through with force. But if that hose has kinks, if the pressure drops, or if the valve is only half open, the flow weakens to a trickle. Your body works exactly the same way. When you were younger, your arteries were wide, flexible, and responsive. Blood rushed through them freely like water through a brand new hose. The moment arousal hit, your blood vessels opened wide and blood flooded into the spongy erectile chambers of your penis, creating firmness that felt effortless and automatic. But as the years pass, things change. Stress, poor diet, lack of movement, and yes, certain hidden mistakes start to damage the inner lining of your arteries. That lining is called the endothelium, and it controls one absolutely critical molecule, nitric oxide. Nitric oxide is the master switch for erections. When it's activated, your blood vessels relax and open wide. When it's suppressed, those vessels tighten and restrict blood flow everywhere, including exactly where you need it most. That's why so many men notice their firmness fading. It takes longer to get hard. You lose rigidity halfway through. Your confidence starts to crack. And the frustrating part is your mind is ready. Your desire is there, but your body just won't cooperate. It's not about age, gentlemen. It's not even about testosterone, though. That plays a role. This is about circulation. Imagine trying to water your garden with a hose that's kinked in 3 places. No matter how much water pressure you have at the source, nothing flows through to the other end. And that's what's happening inside your body. Without open, healthy blood vessels, blood simply cannot reach the muscles, the nerves, and the erectile tissue that create performance. Now here's the part that should give you hope. Your body can repair this. You can actually retrain your arteries to open up again and flood your system with life. But first, you have to stop doing the one thing that's been quietly sabotaging you. And I'm willing to bet you did it within the last 24 hours. Here it is. The mistake that's costing you 50% of your blood flow, 50% of your firmness, and a massive chunk of your confidence. Having a drink or two to relax before intimacy. I know exactly what you're thinking right now. Alcohol helps me loosen up. It takes the edge off my performance anxiety. A little bit is even heart healthy, right? I hear this from patients every single week, and I understand the logic. Alcohol makes you feel more relaxed, more social, more confident. But here's the brutal truth. While alcohol might calm your mind, it is absolutely strangling your circulation. A study published in the Journal of Sexual Medicine tracked men who consumed even moderate amounts of alcohol, just 2 drinks, within 2 hours of intimacy. The results were shocking. Their nitric oxide levels dropped by 45%. Their arterial dilation, the ability of their blood vessels to open wide, decreased by more than half. And their ability to achieve and maintain firmness was significantly compromised. This wasn't heavy drinking. This was 2 beers, 2 glasses of wine, the amount most men consider perfectly normal. So why does this happen? Because alcohol is a vasoconstrictor. That means it tightens your blood vessels at the exact moment you need them wide open. It's like slamming the brakes on a car that's supposed to be accelerating. On top of that, alcohol dehydrates you rapidly, which drops your blood volume. Less blood in your system means less hydraulic pressure to fill those erectile chambers. And it doesn't stop there. Alcohol also interferes with the delicate nerve signals traveling between your brain and your penis. Those signals are what translate mental arousal into physical response. When alcohol dulls them, you get that frustrating disconnect where your mind is ready, but your body just won't follow. This is what doctors call alcohol-induced erectile dysfunction. Some men know it by a cruder name, whiskey dick. It's real, it's measurable, and it's happening to millions of men who have no idea that their pre-intimacy drink is the reason they can't perform. So, when you wonder why it takes so long to get firm, why you lose hardness midway through, or why your confidence has evaporated, this could be the hidden culprit. Not your age, not your hormones. A simple fixable mistake. Let me explain exactly what happens inside your body the moment alcohol enters your bloodstream. Because once you understand the mechanism, you'll never look at that drink the same way again. Within minutes of consuming alcohol, several devastating things happen simultaneously. First, alcohol triggers the release of a hormone called ADH, antidiuretic hormone, which sounds like it should help you hold water, but it actually does the opposite. It signals your kidneys to flush out fluids rapidly. Within 30 minutes, you're dehydrated, your blood volume drops, your blood pressure decreases, and suddenly there just isn't enough hydraulic pressure to fill your erectile chambers completely. Think of it like trying to inflate a balloon with half the air you actually need. It might expand a little, but it'll never reach full firmness. Second, alcohol directly suppresses the production of nitric oxide, that master molecule I mentioned earlier. Remember, nitric oxide is the key that unlocks your blood vessels. It's the signal that tells the smooth muscles in your arterial walls to relax and let blood flow freely. When alcohol cuts nitric oxide production by 45%, those vessels stay partially closed. It's like trying to drive on a highway where half the lanes are suddenly blocked. Traffic slows to a crawl and nothing reaches its destination efficiently. Third, alcohol disrupts your nervous system. Erections aren't just about blood flow. They require incredibly precise nerve signals from your brain, down your spinal cord, through your pelvic nerves, and into the erectile tissue. These signals have to fire in perfect sequence. Alcohol dulls and delays these signals. It creates a lag like a bad internet connection buffering in the middle of a video. That's why men often describe feeling mentally aroused but physically numb. The message from your brain is getting scrambled before it reaches your penis. Fourth, and this is the one most men never hear about, alcohol causes acute inflammation in your endothelium, that delicate inner lining of your arteries. A study from the European Heart Journal showed that just 2 drinks created measurable endothelial dysfunction that lasted 4 to 6 hours. That inflammation directly blocks nitric oxide from working properly, even if your body is still producing it. And here's the part that should scare you. If you're doing this habitually, if you're having a couple of drinks several times a week before intimacy, you're not just affecting tonight's performance. You're training your blood vessels to stay constricted. Over time, this chronic pattern leads to permanent changes in arterial stiffness and erectile function. Your body starts to forget how to open those vessels on command. So when you wonder why firmness takes longer to build, why hardness fades before you're ready, why your confidence has vanished, this is why. Not because you're getting older, not because your testosterone is low, but because you've been unknowingly sabotaging the very system that creates performance. The good news, this is completely reversible. So here's the fix, gentlemen. And I promise you, it's simpler than you think. If you know intimacy is possible that evening, avoid alcohol completely for at least 4 to 6 hours beforehand. That's the window your body needs to clear it from your system, restore normal blood flow, and get your vascular function back online. Now, I already know what some of you are thinking. But Dr. Leah, I need something to help me relax. I need something to take the edge off my performance anxiety. Without that drink, I'm going to be in my head the whole time. I hear you. I understand completely. And that's exactly why I'm not just going to tell you what to avoid. I'm going to give you 3 powerful, natural alternatives that will help you relax and feel confident while actually improving your blood flow instead of destroying it. Alternative number 1, L-theanine. This is a natural amino acid found in green tea, and it's one of the most underrated tools for men's sexual health. L-theanine creates a state of calm, focused relaxation without any drowsiness, without any grogginess, and most importantly, without any vascular constriction. In fact, it actually supports nitric oxide production. You can find L-theanine in capsule form at any health food store or online. Take 200 milliliters about an hour before intimacy. Within 30 to 45 minutes, you'll feel a gentle wave of calm wash over you. Your mind clears. Your anxiety drops, but your body stays alert and responsive. It's the relaxation you want with the circulation you need. You get both, not one at the expense of the other. Alternative number 2, magnesium glycinate. Magnesium is nature's relaxation mineral, and it's one of the most important nutrients for vascular health. It works by calming your nervous system and dilating your blood vessels. Specifically, magnesium relaxes the smooth muscle in your arterial walls, which is the exact opposite of what alcohol does. Take 200 to 300 million about 90 minutes before intimacy. Many of my patients tell me they feel a gentle, steady sense of calm confidence within 30 to 40 minutes. No jitters, no crash, just a deep, grounded feeling of readiness. And here's the bonus. Magnesium also reduces performance anxiety by lowering cortisol, your stress hormone. The form matters here. You want magnesium glycinate because it has the best absorption and won't cause any digestive upset like some cheaper forms can. Alternative number 3, and this one is completely free. Deep breathing combined with light movement. I know it sounds too simple to work, but trust me on this. 10 minutes of slow, controlled breathing, 4 seconds in, 6 seconds out, combined with light stretching or a short walk, activates your parasympathetic nervous system. That's your rest and digest mode, and it's absolutely essential for sexual arousal. This simple practice naturally lowers cortisol, increases nitric oxide production, and prepares your entire body for intimacy. Think of it as priming your system instead of sabotaging it. No pills, no supplements, just your breath and a little movement. Now, let me give you the complete pre-intimacy protocol step by step so you know exactly what to do and when. 4 to 6 hours before intimacy, this is your preparation window. Hydrate with 16 to 24 ounces of water. Don't chug it all at once. Sip it steadily throughout this time window. Avoid alcohol completely. Avoid large, heavy meals. And avoid any antihistamines or decongestants if you're dealing with allergies or a cold, because those are vasoconstrictors too. If you need to eat, keep it light. Focus on lean protein like grilled chicken, fish, or eggs. 2 to 3 hours before, have a small light snack if you're hungry, a handful of raw almonds, some Greek yogurt, maybe a small piece of fruit. The goal here is to stabilize your blood sugar without diverting blood flow to your digestive system. 1 to 2 hours before this is when you take action. Take your magnesium glycinate or your L9, and here's a powerful addition. Drink 8 to 10 ounces of pure beetroot juice or pomegranate juice. Both of these are natural nitric oxide boosters, and they'll start working within 60 to 90 minutes. Make sure the juice is room temperature, not ice cold. Cold liquids cause temporary vasoconstriction, which is exactly what you don't want. 30 to 60 minutes before this is your final prep. Spend 10 minutes doing deep breathing and light stretching. Get your body loose, your mind calm, and your circulation flowing. Then take a warm shower, not hot, just warm, for 5 to 10 minutes maximum. Hot water can actually draw blood away from your core and leave you feeling fatigued. Finally, set your mindset. Focus on connection, not performance. Focus on pleasure, not pressure. When you follow this protocol, men tell me they notice a difference the very first time. Firmness comes faster. It lasts longer. It feels more natural, more automatic, like their body remembers how to work again. And their confidence skyrockets because they know their body is finally working with them instead of against them. But alcohol isn't the only mistake sabotaging your blood flow. Let me show you 4 more hidden culprits that could be quietly stealing your performance without you even realizing it. Mistake number 2, chronic dehydration. Throughout the day, your blood is 90% water. When you're dehydrated, your blood volume drops and your circulation pressure decreases. Even mild dehydration, the kind where you don't even feel thirsty, can reduce blood flow to your pelvic region by 20 to 30%. The fix is simple. Drink 8 to 10 glasses of water daily, and make sure you get 16 ounces 2 to 3 hours before intimacy, not right before, because that'll make you feel bloated and distracted. Mistake number 3, trying to perform when you're exhausted. One night of poor sleep reduces your testosterone by 15% and significantly impairs nitric oxide production. When you're sleep deprived, your body simply can't generate the hormonal and vascular signals needed for firm erections. Studies show that sleep deprivation is hormonally equivalent to aging 10 to 15 years. The fix: prioritize 7 to 8 hours of quality sleep, especially on days when you're anticipating intimacy. Mistake number 4, eating high-sodium processed foods before intimacy. Salty processed foods cause temporary arterial stiffness and raise your blood pressure in the wrong way. Instead of opening your vessels, they constrict them. The effects last 3 to 4 hours. The fix is to stick to whole foods, especially those that naturally boost nitric oxide like leafy greens, beets, watermelon, and dark chocolate. Mistake number 5, sitting all day without movement. Prolonged sitting reduces blood flow to your pelvic region and suppresses nitric oxide production. If you have a desk job, your circulation is already compromised before the evening even begins. Studies show that sitting for 6 or more hours daily creates measurable declines in erectile function. The fix: take a 10-minute walk 1 to 2 hours before intimacy. Here's what you need to understand. All 5 of these mistakes are completely avoidable. They're not about aging. They're not about genetics. They're about daily choices. And when you stop making them, your body remembers how it's supposed to perform. But avoiding mistakes is just the beginning. True confidence, the kind that lasts, comes from rebuilding your circulatory system from the inside out. Because, gentlemen, this isn't just about tonight. It's about creating a foundation for consistent, reliable performance for the years ahead. Let me give you the daily vascular health protocol that will transform your baseline circulation. Every morning, start with 8 ounces of pomegranate or beetroot juice with your breakfast. Then get 10 to 15 minutes of light cardio, a brisk walk, cycling, swimming, anything that gets your heart rate up and your blood moving. Finally, take 200 to 300 ml of magnesium glycinate. This morning routine sets your vascular tone for the entire day. It's like priming a pump before you turn it on. In the afternoon, stay hydrated with at least 16 ounces of water. Snack on nitric oxide-boosting foods like dark chocolate, 70% cacao or higher, a handful of walnuts, or a spinach salad with beets. These foods maintain your nitric oxide levels and keep your blood vessels responsive throughout the day. In the evening, avoid alcohol after 5 or 6 p.m. If intimacy is possible later. Don't eat heavy meals after 6 p.m. Get 30 minutes of gentle movement, whether that's a walk, some yoga, or stretching. And before bed, drink a small glass of tart cherry juice. Tart cherry juice is rich in antioxidants that repair your blood vessel walls while you sleep. Think of it as recharging your vascular system overnight. Weekly commit to 4 sessions of aerobic exercise, 40 minutes or more at moderate intensity, and 3 sessions of pelvic floor exercises. That's Kegels for men, 3 sets of 10 contractions daily. These exercises strengthen the muscles that trap blood inside your penis during erections, giving you firmer, longer-lasting performance. Now, I need to give you a few critical warnings so you can make informed, safe decisions. First, if you're currently taking medications for blood pressure, heart conditions, or erectile dysfunction, drugs like Viagra or Cialis, talk to your doctor before making any changes to your routine. Some of the natural nitric oxide boosters I've mentioned, especially beetroot juice, can interact with these medications and lower your blood pressure too much. Second, if you have severe consistent erectile dysfunction that doesn't improve after 4 to 6 weeks of implementing these strategies, you need to see a urologist. Persistent ED can be an early warning sign of cardiovascular disease, diabetes, or serious hormonal imbalances that require medical treatment. Don't ignore it. Third, if you have kidney disease or you're on dialysis, avoid beetroot and pomegranate juice without medical supervision. These juices are high in potassium, which can be dangerous if your kidneys aren't filtering properly. Fourth, understand that these strategies work best as part of an overall healthy lifestyle. They cannot overcome uncontrolled diabetes, severe obesity, or untreated hypertension. You have to address those root causes with your doctor. And finally, if you find it genuinely difficult to avoid alcohol, even for intimacy, that may indicate dependency. If that's the case, please seek support. This is a health issue, not a willpower issue. For most men over 50, these changes are safe, natural, and incredibly effective. But always put your long-term health first. So here's what I want you to do this week. Choose one evening when intimacy might happen. Avoid alcohol completely for 6 hours before. Follow the pre-intimacy protocol I gave you. Hydrate properly. Take your magnesium or L-theanine. Do breathing and movement. Then come back to this video and tell me what you noticed. Comment below. I read every single comment personally, and your experience could be the encouragement another man needs to make this change. If you found this video helpful, share this with another man who deserves to understand what's been holding him back. I'm Dr. Mika Hayashi, and I will see you in the next